I said, when a first person in the first minute mentions his pains, how long does it take before how long does it take before he gets into a movement of growth? When a person comes in and he talks about a creative issue, how long does it take before he starts to get in that movement? And then with one, maybe it takes 3 weeks or it takes 2 months before I can get in further. The other one goes a bit quicker. How quick can they accept that that everything is just an expression of a transformation, of a growth process? Whatever their symptoms, the emotional unbalance, which is just another balance of their emotions, the fact that they face something that is unknown for them or something like that. So it's and it is not so that people who have done a lot of work on a spiritual path or whatever are more ready than people. Yeah, here in Bangkok I will not see that, but in my daily practice in Europe, I see also people that come from the countryside, farmers, older people who were illiterate, who were analphabets, and who understand immediately what we are working on. So it doesn't really matter that the people have an enormous culture or an enormous spiritual culture or an idea of alternative medicine. When they can read the signs of nature, of this, of that, they have a good feeling with their body. It's very quick. You can work very quick with them. Some people need to always feel first the pain before they can adjust a little bit. And that takes a bit longer. Yeah. That might take a bit longer. And there are a bit more serious issues also. There are pathologies where we have to analyze far more, because some pathologies put people's life in danger, and then we have to see a few other aspects.
So I guess in a sense that you'd encourage whoever that feels that they need to have a balance, and it doesn't have to be from physical pain or physical imbalance.
No, but you have to be, in a way, I find that as an osteopath, I put myself a little bit like a physician or physiotherapist, a little bit in the same order. A doctor, in American is called a physician, works with the physical body, and a doctor in French is called un médecin, or in Italian a medico, where the initial part of that word means actually the middle. It comes from medium, from the Latin word medium, so from the middle. And what a doctor does, he gives a remedy, and it says remedy, the final part of that word is again the center, and the first part of that word is re, which means again, to come again to the center. So what a doctor is supposed to do is to center his person back at a physical level. And he may not confuse to take part in, let's say, a spiritual path. He will take part in a spiritual path, where the spiritual path, interpreted by religion, which comes from the Latin word religere, which is to reconnect. It's reconnect vertically. Now a person can only reconnect when he is also put back in his own center. So what the doctor does is bring the person back to his center, so that the person then automatically can reconnect vertically in his spirituality. If there is a spiritual unbalance, then there are spiritual guides that can help better than doctors. And I say, personally I know my place. I know that I work at a physical level. I try to center people knowing that at that moment they can also center more spiritually, they can move forward better, they can confront whatever is there to confront. And not all pathologies have a outcome that we wish. Sometimes the outcomes can be different than what we wish. We can center the people to confront also an outcome that we are not wishing for. As an alternative medicine, I don't believe that I can cure, I don't pretend to cure a fatal pathology better than traditional Western medicine or traditional Chinese medicine. But I can center the people to accept what is going on, the path that they are walking at that moment. And with very beautiful pathologies, like the pregnancy of a woman, the menopause of a woman. Those are very beautiful pathologies. You can guide that pathology and guide the change that is taking place, so that person feels like, well, I get centered in a new form of a new identity in my life that I had not experienced before. I changed from an old identity to a new identity, and there is a change taking place, and we can guide that change that goes through a pathology. And some of the pathologies are very beautiful. Some of these pathologies can be a bit suffering.
So you
some pathologies can be fatal.
I see. Yeah. So you also offer therapy to pregnant women as well?
Yeah, that happens very often, yes.
I see.
Pregnant women, and it doesn't have to continue therefore, but the major part of my work has been always around the menopause.
Menopause.
70% of the work that I've done. I saw maybe 15,000 people, so 10,000 of them have been menopausal. Yeah.
Okay, great. Thank you. Thank you very much. Looking forward to having you here at Omroom.